Atwell, can I ask, in a second breast reduction, can the nipple blood supply be saved? Yes, it can. Good question, Atwell. It can. Absolutely, it can. But the important thing for a second breast reduction is that you need to ideally know the pedicle that was used in the first breast reduction. So ideally use the same surgeon if you can. It might be many years ago, but if your next surgeon for the second breast reduction can get your operation note from the clinic or from the surgeon, that would be really helpful, because we would use the same pedicle for the second breast reduction that was used for the first breast reduction. So pedicle means how the blood supply to the nipple is kept going to the nipple. And just to put it broadly speaking, it can be sort of north, south, east, west. You can have pedicles any which way. There are more common ones, I guess. Inferior and superior are kind of more common, and superior. But still, you can have lateral, you can have bilateral, you can have, horizontal bipedical, vertical bipedical. You can have all sorts. So basically, if you have the nipple held on a stalk, let's say, for instance, from a superior pedicle from your first operation, so all the blood supply is coming from the top into the nipple. When they do it, they lift the nipple up, and then you have the second breast reduction. They don't know what pedicle you've used, and they decide to use an inferior pedicle. Then they're going to completely cut your superior pedicle, and the second breast reduction, that blood supply is going to be coming through scar, which has got a very high risk of the nipple not surviving. So yes, you don't. Ideally, you want to know what pedicle it was. So yes, you can have a second breast reduction, and the blood supply can be saved. But ideally, you'd want to have the details of the first breast reduction, particularly the operation note, so they can know what pedicle.